My name is Susan Palmer and I'm one of the founders of Gather Group. We build technology to address the missing piece in patient care. I'm a psychologist and for the past 20 years I've been working in healthcare. Over that time I've met many people like George. George's daughter was born with a catastrophic brain injury. As her primary carer, he has been on call for 24 hours a day ever since. I met George after he had a car accident because he fell asleep at the wheel. Unable to care for his daughter, she'd been admitted to hospital for 2 weeks, costing the health system $18,000. This story, and many more like George's, highlight the burden that we place on informal carers and the hidden costs to the health system when they can no longer care. Our system relies on informal carers to function. 2.8 million Australians provide 2.2 billion hours of care every year, and when they can no longer care anymore, the burden shifts to our acute health system at extreme expense. To tackle this problem, we must unlock network care, and the key to network care is technology. Technology that can bring people together, identify unmet needs, coordinate care, upskill networks, and identify risks. And this is Carer IQ. Carer IQ supports friends, family, neighbours and community to work together to improve informal care, to reduce the burden on primary carers like George, to limit the amount of avoidable hospital stays, and to lower the costs on the health system. Our Phase 1 technology has been in the community for the past 4 years through these referral partners. Over that time, we've shown that we can increase the number of informal carers around someone in need from 2 to 15, and we can increase the hours of support they get from 20 to 60 hours a month. We've also shown that we can target that care, making sure that people get exactly the right support they need to have the greatest impact. We're now looking to take our technology to the world because the need for network care is a global one. 400 million people live with chronic conditions, and the systems in countries like USA and the UK are in much worse condition than ours. We'll be focusing on these 4 areas of chronic illness and building carer networks through a B2B SaaS model. Customers such as insurance, hospitals, aged care, pharmacies and community health organisations benefit from the improved outcomes for both patients and carers like George, which reduce the costs on health services. We'll also be building the first ever database of informal care so that we can better understand what's happening for these families and improve services and supports. Our team has the ideal mix to make this a reality, and we each have 20 years' experience in our chosen field. We're looking for supports to launch our organisation and particularly connections to industry. Thank you.